Buenos dias. We're here with Dr. Jorge Arauz, and we're going to be making a video for CostaRicaHospital.com. Good morning. How are you?
Good morning, Mary. Nice meeting you here.
I know that you're a cardiologist,
Yep.
which deals with the heart, but not everybody knows what interventional cardiology is. Can you tell us about that?
Well, I do a special procedure. I'm trained in a special procedure called angioplasty and stent deployment. That's a procedure I do just percutaneously, not via the femoral or the radial artery, and we put some catheters inside the artery just to identify some blockages of cholesterol, and we try to open the arteries after that, just in one session, and while the patient is awake with little sedation.
What exactly are your qualifications? Where did you attend school?
Well, I was trained here in Costa Rica as a general physician, and I did my training in internal medicine and in cardiology here as well. After that, I was trained in congressional cardiology in South America, and I've been attending many hospitals in the U.S. for these 12 years since I graduated. And I've been doing these kind of procedures ever 12 years right now. 11 years, so I've been doing it for 11 years right now. I have almost 6,000 procedures performed, and well, it's been a great time doing this. I enjoyed it very much.
What procedures exactly do you do to help your patients?
Well, coronary heart disease is the #1 killer of also not only in the US but also in Europe and many Latin American countries. So what happens is there's a blockage of cholesterol into the coronary arteries. This is the arteries that supply the blood to the heart. So a heart attack is the result of a blockage of a broken plaque just on one of these coronaries. So what I do is a procedure called angioplasty and stent deployment. This is things that it's been done, as I mentioned before. Just you put via the arteries of the arm or the leg. You just go with a catheter down to the heart, straight ahead to the coronary arteries, and you open the arteries by introducing a small balloon, and after that, just by putting a metallic device that's called stent, and this reopens the artery, so you won't have any trouble anymore. This is commonly done. It's a safe procedure, and it's been done 10 or 5 patients per day. I usually do this, and as well we do this on the carotid artery, and just by opening the arteries, so you wouldn't have any stroke. And well, I also work with some associates that are called electrophysiologists. So there's a cardiologist that she's specialized in electricity of the heart, and we put devices like pacemakers, like ICDs. These are newer kind of pacemakers designed just to help people to heal, so to be protected from lethal arrhythmias, or just to make them feel better when they have advanced heart failure.
Are there any differences in technique or equipment that you use than there is used in the U.S.?
No, Mary, no. Definitely there are no differences in techniques. Also, it's also the same equipment that we use in the same technique. We were trained as well as an American physician does, interventional cardiologists. Indeed, we've worked with them in the U.S. And also all the materials, all the stents that are used are produced by the same companies and the same materials that are used in the U.S. or in Europe abroad. So there's definitely no differences in this kind of material and in all the techniques that we use with our patients here than your interventional cardiologists will use in the U.S.
Why do you feel someone should choose you as their cardiologist over another doctor?
Well, first because I love what I do. I've been doing this for a long, long time, more than 10 years. And I have done a lot of procedures, many, more than 6,000, so it's quite a great experience, and I'm very skilled in what I do. And well, I think the fact that if you like this and you're quite skilled, well, this is a good advantage.
What exactly is it that you love about being a doctor?
Well, there's one thing I love the most here, is that you can see the instant recovery of the patient. If your patient has an angina and you make this procedure, the day after that he won't have any angina, and he will be protected for having another heart attack for a long, long time. And after that, it gives you kind of a relationship with your patients. I say that once you have this done, you are remarried to your cardiologist. And I like to say that I do not have only patients, but I gained a lot of friends. And you get a very special relationship with them. So this makes you a little bit proud of doing that, and gives you a wonderful feeling about this.
Hey, in regards to the actual procedures, how many times do you see your patients before the procedure? Is it you that actually sees them in the recovery room and follows up with them? Is it an associate? In the U.S., it's usually an associate, a physician's assistant. But is it you in Costa Rica? Is it the main doctor that actually handles all of that?
Yes. Here, I like to see the patient before I do the procedure. I want to have a meeting with him at the office and talk to him, explain to him what we are going to do, see what kind of tests he's taken, he already had done, and to measure the need of the procedure, of course. And well, I do the procedure myself, and here I like to see the patient after that. So I'm the one in charge of my patient after the procedure. So you will have to see my face all the way along after you leave the hospital, after you are discharged. And if necessary, I will see you again. But most of the patients just do well and can even travel 1 or 2 days after that without having to see me. Okay. But yes, the follow-up of our patients is being done basically by me. I like to follow them.
What sort of tips do you give your patients post-operatively after their surgery? Are there any diet restrictions, exercise? Can they travel quite quickly?
Well, the normal tips are the one that you should follow as well. Even if you don't have a heart disease, you will have to. If you have a cholesterol plaque on the arteries, well, you have to follow a good diet. You have to lower your intake of fat or cholesterol. You will have to do more exercise. And if I put a stent in there, in the artery, you will have to use aspirin and another medication from 6 months to 1 year. And the recovery, in immediate recovery, is very, very fast. You can, in 12 hours, you can stand up, you can lead a normal life. You will have a mild bruise here on the leg, and you can be suitable for traveling on a commercial flight from 24 to 48 hours after the procedure has been done.
This is Mary Hickox, registered nurse with CostaRicaHospital.com, saying muchísimas gracias to Dr. Jorge Arauz.
Muchas gracias. Thank you for being here.
Gracias.
Fue un placer tenerte acá.